Hello, everyone, and thank you for tuning in to this new episode of BEaTS Research Radio, a podcast and YouTube channel that aims to disseminate science and research to the community. My name is Deyanira, a PhD student in biochemistry at the University of Ottawa, and I will be your host in today's episode, which will be part of an episode series that will explore the impact of exercise and in our health. We're honored to be joined by Dr. Catherine Sabiston, a professor of exercise and health psychology at the University of Toronto. Dr. Sabiston holds a Canada Research Chair in Physical Activity and Mental Health to conduct research related to understanding physical activity, motivation, and mental health, including body image, physical self perceptions, anxiety, depression, and stress. Her research focuses primarily on females across the lifespan in clinical populations that are the least active segments of the Canadian population. Dr. Sabiston holds a Bachelor of Science in Kinesiology and Exercise Science by Dalhousie University, a Master's degree in Sports and Exercise by University of Windsor, a PhD in Kinesiology and Exercise Science, and a postgraduate degree in Public Health and Epidemiology by University of British Columbia. Thank you for joining us, Dr. Sabiston.
Thanks for having me.
Yeah, sure. So I'm going to start with the first question, and I would like to start by asking you a bit more about yourself. Could you explain and share with us what is the focus of your research and what inspired you, or what was your motivation to pursue the career that you currently have?
Sure. Yeah, so my research focuses on really the context of both physical activity and mental health, and those are very broad constructs if you think about it. So we study physical activity in the context of leisure activity, of exercise, of sport practices, anything to do with physical activity, and then on the other side of it, in terms of mental health, studying factors related to as you mentioned in the introduction, anxiety and depression, so symptoms of mental health, as well as body emotions, body image tied to mental health, and flourishing and positive aspects of mental health as well. So, we look at the relationship between these constructs and how they relate to each other. And so what we know is that, physical activity reduces some of the symptoms of mental illness, as well as, promotes some of the positive aspects of mental health. But we also know the reverse, so that mental health and mental illness, the symptomology can interfere with one's motivation and experiences in physical activity. So we study, what that looks like. How can we best contextualize physical activity and mental health so that more people are active and enjoying it?
Thank you so much. I really consider that this episode is really important for people that are not really related with the field, and to have an expert like you could help us to provide us with more important information that could help to better educate ourselves, because I really think that these topics should be discussed more in the community.
Absolutely. And I think, the second part of your question, what inspired me to get involved in the research that I do, really comes from a place of, as you mentioned, I did all of my degrees in science. And a lot of the work that I did was in a lab and was focused on, experimental work with people. And what I also often realized was, as much as the blood marker is showing a certain aspect, I saw the person face to face, and I saw the impact that, the drug interventions that we were using, or the cognitive behavioral therapy that we were using, had an impact on people differently than what the measured outcomes we're looking at. And so early on, when I was in my undergrad working in these labs, I just kept thinking there has to be more. Someone has to start asking people how they feel. And that's where, and my parents always encouraged me to be the research study participant. So be involved in the studies that you were doing so that you knew how it felt. And across all of those experiences, it just again kept making me think people aren't studying enough about this interaction between what the body's doing physiologically but also psychologically. And so, and that kind of my career kind of shifted at that moment of my experiences in these labs, and seeing that what people are telling you is quite a bit different than what their bodies might look like.
Yeah, I totally agree. I think as a researcher, sometimes we focus a lot on the results that we want to have, but we don't really consider how like the people is feeling. So all this part I consider is really important too.
Yeah.
So thank you. I would like to continue with the second question, and it is in your research, do you consider that a multi-sport practice approach could have a positive impact on adolescents' body image perception and their level of embarrassment compared to a single sport practice approach?
Yeah, so a lot of the work that we've done recently focused on sport participation specifically is within this context of we know that being physically active across the lifespan has so many benefits. And from the research that you've shared with me, like from a heart health perspective, from across all systems. And yet we also know that very few people in Canada and around the world are active at levels that are conducive to those health benefits. And so it really does start with youth. And when we think about youth practices around physical activity, it actually really starts with sport. And so a lot of our research has been focused on sport and this, the disconnect between participation in sport for girls and boys. And what we want to know is, why do girls drop out of sport at rates as high as 6 times more likely than boys to drop out of sports during adolescence? And they're less like girls are less likely to like sports. They're less likely to say that they enjoy it, and so we really wanted to understand more about that. And studying the sport context, you can study it in a bunch of different ways. And so you can look at team sports and individual sports, and then you can look at the number of sports that people are engaged in, and what that means. So across a number of studies that we've done, if I was to summarize it, I would say that generally speaking, team sports are better for your mental health than individual sports. And we see that as protective effects long term. So when we study adolescent mental health, and then we look over time, 5 years later, we see that in adolescents who participated in team sports were much less likely to be experiencing mental illness symptoms 5 years later. And that wasn't the same for individual sports. And what we talk about is there are benefits to individual sports that are unique to team sports, but the team sport environment where you have to work together, there's a collective sense of efficacy, there's you're producing effects that are not only dependent on your own behavior but on others as well. The moral development, the social development, the connections that you make in a team are all quite important factors when we think about mental health. The individual sports tend to be those weight focused, judgment based sports. And so you benefit by being involved in those sports, but you need the sort of social connectedness, team element to balance it. And so including a bunch of different types of sports in your practices are better for your mental health, as well as sports that are that differ in terms of the type of uniforms that you need to wear, in terms of the environment that you engage in, are more likely to produce positive body image effects. So, in choosing sports that you enjoy that have different uniform elements to them, that include different aspects of working with other people, and that allow you to feel free to be in your own body the way that it is important for especially for girls, but for boys and girls, that again have these long lasting effects.
Thank you so much for that amazing answer. I actually didn't have idea of all of this information, and I think this could also be used by the system to create more strategies to help our kids like Joe to feel part of something and to feel better with themselves. So yeah, thank you so much. So, I would like to continue with the final question. That is, what strategies do you think or do you consider that are important for trainers, dietitians, and other health-related professionals to implement for reducing an environment where adolescents develop body-related shame and guilt?
It's a really important question because we can, as leaders in sport and around youth in general, again, we want to create a very supportive, protective I often describe it as like the bubble wrapping around your kids, the kids in our society, so that they feel like they belong, and that they can stay belonging and enjoying sport for longer. We know that sport and enjoying your sport and feeling like you can do it, so competence and enjoyment are the critical predictors of whether someone will stay in sport and enjoy and maintain that participation. So as leaders in these spaces, we want to make sure that youth are involved in sports that they enjoy, that they build their competence, that you can see that you can engage in these things, that there's smaller tasks that they can achieve so that they're getting positive feedback and not these big, goals that are hard to achieve, and that there's always this, more negative feedback. You want to create an environment where there's lots of little bits of feedback, again, that kids are working together to create a social connection that they have beyond their school environment or their home environment. um, in places that we work also, we see that kids who participate in sport are very different. It's a different environment when you're actually training in your sport versus going to other locations to train. So for example, some kids will have to train in gyms, in community spaces, community centers, community gyms. And those gyms that are chosen by us as leaders to be the place where they train might not be the most protective and supportive environments. These kids might see people that are, very different than them. They might, oftentimes we hear of gyms where there's posters of, like, the fit idealized body that, they wanted to avoid, and now you're facing with it. So the social media aspect of these gyms can be challenging. So like, obviously physical literacy, and social media literacy is important when we're working with kids, but also just creating these environments in creating safe and socially connected spaces where everyone, no matter what identity factor we're talking about, across the spectrum, can feel like they belong. And that is the critical piece in terms of keeping kids in sport. And it really does tie to their mental health as well as their body image generally.
Thank you so much. I completely agree with what you are saying here. As sometimes when you go to the gym, for example, you see these posters of perfect bodies or all the stereotypes that makes you want to fit on those stereotypes, and that is not good for our mental health because personally that had happened to me. Like, try to compare myself, which is not good for like anybody, I think.
No, I mean, social comparisons, we often say, it's really important to reduce the social comparative nature of sport. Physical activity, sport, exercise, they're all environments that are very judgment based and socially comparative, and you're out there among others, and there's always people watching you, and so it's about, again, creating strategies where athletes and kids generally can feel like they don't need to compare to others, and that they're in this for themselves, and that positive feedback and, making sure that the environments that they're engaging in are supportive and fun is the critical piece to, again, like, a long life of not only physical activity behavior but also mental health.
Yeah. Thank you so much for this amazing answer and for this incredible interview, Dr. Sabiston, and for accepting to join us for this episode. And well, I would also like to thank all the BEaTS Research Radio listeners for tuning in. And don't forget to like and subscribe to our YouTube, Twitter, and Instagram channels at BEaTS Research Radio. And